Thank you for joining us for the 4th Annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the Key to Accelerating Innovation, a collaborative partnership between the American Association of Kidney Patients and the George Washington School of Medicine and Health Sciences. My name is Kevin Fowler, and I'm a former board member for the American Association of Kidney Patients, and I continue to serve as a AAKP Ambassador for the state of Missouri. I'm also someone living with kidney disease, having received a preemptive kidney transplant in 2004. And based upon my experience of living with the consequences of polycystic kidney disease and facing the reality of kidney failure, my goal was to avoid dialysis by receiving a preemptive transplant. And my hope for all individuals suffering from kidney disease and facing kidney transplant is for them never need to go on dialysis and to receive a preemptive transplant, so that a preemptive transplant becomes more the norm rather than the exception as it is right now. And as a fellow patient advocate, or as a fellow patient, I have a deep passion for patient advocacy and patient engagement in the production and device lifecycle of novel treatments that answer the need and preferences of patients and their families. And those that are going through the journey of kidney disease firsthand, who really know what it's all about. This passion has led me into a career spanning over 30 years in both commercial and research and development roles for commercial enterprises. In addition to my role with the AAKP, I'm also the patient editor for the Clinical Journal of the American Society of Nephrology, CJSN. I'm also on the board of directors of the Kidney Health Initiative, which is a public-private partnership between the American Society of Nephrology and the US FDA. KHI has a mission to catalyze innovation and development of safe and effective patient-centered therapies for people living with kidney diseases. And for today's session on Global Kidney Patient Voice, the key to accelerating innovation, industry efforts across the globe advancing kidney patient care, I had the pleasure of conducting a series of interviews with national and global companies in the kidney space that are leading the effort to disrupt the status quo by making an investment in new treatments to address the many unmet needs of people living with kidney diseases, while also working tirelessly to integrate the patients and their unique insights along the way. In full disclosure, based upon my professional background working with life science companies, I have consulted for some of the organizations that I have interviewed. I enjoyed speaking with all these industry representatives across the globe and ask you to join me in watching excerpts of these interviews. Full interviews will be available post-Global Summit on demand on AAKP's social media platforms and YouTube channel. Thank you, and I hope you're just as inspired listening to these discussions as I was conducting them.
I think the voice of the patient is extremely important. And I think over time recently, patient advocacy groups have become very important in drug development, testing new technologies, and they're the best advocates for people living with the diseases that they have. Well, the biggest unmet need in kidney transplantation is to eliminate the need for immunosuppression. Immunosuppressive agents are wonderful in that they prevent rejection of the graft, but they take their toll on patients over time. And as a result, there's a shortened lifespan. The kidneys eventually fail because of the toxicity of the drugs. They're susceptible to infection and to a number of other complications that shorten their life and impair their quality of life. So clearly that's the highest unmet need right now in kidney transplantation. I'm a transplant surgeon by training, and I've seen firsthand the challenges that my patients face with having to take chronic immunosuppression for their life and deal with all the potential complications, including heart attacks and metabolic disorders, infection, malignancy. And I think it's critical that the patients have a voice in clinical trial design, because often the patients are willing to take more risk than some of their doctors are. And they need to have a voice in completely understanding the risk-benefit ratio of any trial, and then having the freedom to choose whether to proceed or not. So they play a major role, and they have in the FDA with drug development and drug approvals. And, I think it's critical to involve patient advocates. Well, my life's work has involved finding a way to trick the immune system to eliminate the need for immunosuppressive drugs. And fortunately, we were able to identify a novel cell in the bone marrow that allows the bone marrow to take and re-educate the recipient's immune system to see the donor as a friend rather than something to reject. And now that is underway, being tested in a phase 3 study with 17 sites involved, where we are essentially evaluating whether we can reproduce what we had in the phase 2, where we were able to get over 82% of patients who had a kidney transplant completely off immunosuppression. I think that's a really interesting statistic. I was not aware of that. I would strongly encourage patients to approach their doctors and to express a desire to be aware of clinical trials and to make people aware. There's a website that the government has called clinicaltrials.gov that lists all clinical trials that are underway. And I think if people became more and more aware of that and knew that they could access information on any clinical trials related to kidney disease, for example, or kidney transplantation, that they could inform themselves and inform each other of opportunities available to enroll as candidates in various studies.
I'd like to thank again the vast number of industry partners that took the time to sit down and have a discussion with me. Through AAKP Global, launched in 2019, AAKP is engaged globally because we are committed to educating patients, leaders, and companies across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe treatments. Globally, AAKP is working with patients, medical professionals, researchers, and medical industry allies, such as those you just heard from, to cultivate a united consortium led by patients. AAKP believes that this global consortium can advance innovation and change kidney care in countries where health systems or infrastructures do not support patient consumer choice or access to care treatments. Again, thank you to each of our industry partners for sharing with us the innovations their companies are working on or has available to improve kidney care, from prevention and diagnosis to transplantation or access to care treatments.